Hello, and welcome to the North Carolina Medicaid Managed Care webinar. Before we get started with the presentation, I'll share some quick housekeeping. We've had such strong interest in this webinar that we're broadcasting it live. This means you'll need to be sure to have the audio on your computer turned on, otherwise you will not be able to hear the webinar. If you do not have audio on your computer, you can call this bridge line 562-247-8321. That bridge line again is 562-247-8321. You'll need to put in this access code 613-403-382. Again, that access code is 613-403-382. If you experience any technical difficulties, please visit gotomeeting.com and click support or call 1-888-646-0014. All attendees will be muted during the presentation. If you have any questions, please type them directly into the questions box in the toolbar at the side of your screen. At the end of the presentation, we'll open for Q&As and answer the questions that were submitted. For future reference, and for those who weren't able to attend, we'll email a link to the recording of today's presentation, as well as post it on the Medicaid Transformation page. Please note, the documents that will be reviewed during the presentation are posted on the North Carolina Medicaid Playbook site. And you can see those URLs on the bottom of the screen. If you can click to the bottom of that screen that has the URLs. Today's presentation will cover the North Carolina Medicaid Managed Care transition and its impact on beneficiaries, the timeline for open enrollment and what to expect in terms of communication to beneficiaries, and how you can partner with the enrollment broker to educate beneficiaries. Now I'd like to introduce you to our panel of speakers. We have Dave Richard, Deputy Secretary, Medicaid, Sandy Terrell, Director of Benefits and Services, Medicaid, and Eric Rubin, Division President for Health Services at Maximus. I'll now turn it over to Dave to begin the presentation.
Good afternoon, everybody. I'm glad you can join us today. We're excited to have this conversation with you. So we're going to start with a little bit of sort of level setting for everyone, and then get into more detail about how the enrollment broker process will work and as we're moving forward. But I'm going to do a little bit of just a level setting for folks about where we are in managed care and what that looks like. So we're all using the same terminology. The first thing we always want to start with is the vision that North Carolina DHHS has for our managed care transformation. I jokingly say to folks often is that there are a lot of vision statements that are sitting around offices that people don't look at. This one at DHHS, we spend a lot of time thinking about it, is really what we're trying to achieve inside of managed care. And I'll read it because I think it's important for people to hear it, is that we're improving the health and well-being of North Carolinians through an innovative, whole person-centered, and well-coordinated system of care that addresses both medical and non-medical drivers of health. In that we hit the key components of value, of making sure that we have behavioral health integration, and that we are really looking at the social determinants of health as we move forward with Medicaid managed care. We'll turn to the next slide. There are a lot of words that we use as we're transitioning into managed care. You know, at government agencies and DHHS, we have a lot of acronyms. We're trying to make sure that we define the words that we use that may be different and be clear. I won't read them, but I'll highlight a couple of these for you. One that is really important is that currently, I think most people know that our system is in general a fee-for-service system. As we move to managed care, we want to make sure we're able to distinguish between that fee-for-service system and the managed care program. So our current fee-for-service system, we will be calling North Carolina Medicaid Direct. which again is for certain populations that will not move to managed care, will continue to receive services through fee-for-service. Under North Carolina Medicaid managed care, the state will contract with insurance companies. We call them prepaid health plans, but often you'll hear interchangeable, the insurance company or the PHPs. They will be paid a predetermined set rate per person to provide all services. Eligibility doesn't change. Eligibility is the word that we use for a person who qualifies for North Carolina Medicaid or Health Choice. And these eligible individuals, many of them will have to enroll in a health plan under North Carolina Medicaid managed care. Enrollment is that process of joining a health plan. So eligibility, eligible for Medicaid, enrollment, joining a health plan. A beneficiary is a term that we've used in North Carolina since Medicaid has started, and those are individuals who are eligible for Medicaid and will receive Medicaid services. But once they become inside of a health plan, the health plans will call them members, just like in any other insurance product that we have. And then inside of North Carolina managed care, there are actually going to be two plans that we'll talk about that you'll hear about. One is the standard plans. And standard plans, the way I would think about it, are the plans that you typically would think are the plans for most folks for their regular health insurance. A unique feature of our standard plans here will be the inclusion of behavioral health and physical health integration for those people with mild mental health and substance use needs. For those people that have traditionally thought about the behavioral health services in LME MCOs, we will wind up enrolling those individuals into tailored plans, which will meet the very specific and unique needs for people with more intense mental health and substance use services, those with developmental disabilities and traumatic brain injury. That will start in 2021. So let's talk a little bit about what Medicaid transformation really is. And we have two big bullets here, and just say a little bit about those. One is that North Carolina Medicaid managed care is where most people will receive those services. Under managed care, the health plans, the PHPs as we described, will be at risk for the members that they provide services to, meaning that we will pay a fixed rate based upon actuarially sound numbers, and they will be responsible for providing the services to those individuals inside of that health plan for that fixed rate. The services that are available for those individuals continue to be the same services that are in North Carolina Medicaid today. So a little bit about who's impacted. The people that will go into managed care will be 1.6 million of the 2.1 current Medicaid and Health Choice beneficiaries in the state. And again, we're calling this population a crossover population to make sure that people understand they're moving into managed care. So we'll move to the next slide. When we move to managed care, and those of you that have read our position papers and policy papers recognize that we have really lofty goals for the long-term vision of managed care. And that is that we really want to have value. We want to make sure that behavioral integration works, that we're paying for social determinants of health, and that we are really transforming the system to think about outcomes rather than just process. But we want to assure everyone on this call and the people across the state of North Carolina that day one of transition to managed care, it's really going to be about the beneficiary, the members of the health plan, and our providers. So you see on our slide that number one is that if an individual has an appointment that has been scheduled prior to go live of managed care on November 1st, then they will continue to be able to see that provider, that we will not have a disruption of service. If a person has a prescription to be filled at the pharmacy, they'll be able to get that prescription filled. There will be no disruption in that person's pharmacy needs. A provider that was enrolled in Medicaid prior to November 1 will continue to be enrolled in Medicaid. Now, they will have to have contracts, and we'll talk more about that with our health plans, but they will continue to be enrolled in Medicaid. And then, most importantly for providers, if they provide services to a Medicaid beneficiary, they will be paid for that service. Our goals are lofty for managed care, but day one and for the beginning phase of managed care, the most important thing that is there is that the beneficiaries receive the services that they need and that providers get paid for providing those services. So let's talk a little bit about who's enrolled in managed care. There are populations that are mandatory that will be inside of managed care, and that's the vast majority of people on Medicaid. There are a few populations that are exempt from managed care that will have the option to remain in Medicaid Direct or transition, and then there are a few populations that are totally excluded from managed care. Let me talk a little bit about the populations, though, that are excluded and what that looks like. So those who qualify for Medicaid and Medicare are duly eligible. Initially, they're excluded from this transition to managed care. Law says that at some point in time in the next 5 years, we'll move the duly eligible into managed care. People that are enrolled in the program for all-inclusive care for the elderly, PACE members, are excluded because that is a managed care program and they will not go into managed care. Those individuals who have spend down limits will not be moving to managed care. Those who are undocumented aliens who qualify for emergency services will not move to managed care. Those who are presumptively eligible will not make that move. We have a small program called the Health Insurance Premium Payment and those members will not move. Those who receive CAP C and CAP VA services will eventually are required to move into managed care, but that will be a delayed population. Those on an innovations waiver will go into managed care later with the tailored plans, as well as those individuals who have significant mental health and substance use needs. And finally, those who are only on the family planning program will not go into managed care at all. They will be kept out of that. We also have a federally recognized tribe inside of North Carolina, which is the Eastern Band of the Cherokee Indian. Those individuals are considered exempt. They could choose to enroll in a North Carolina Medicaid managed plan or stay into Medicaid Direct, but they will not be assigned to a managed care plan when they're there. And if a beneficiary is not enrolled, those people that should be enrolled in managed care, they will be auto-assigned by September 16th for phase 1 or December 16th for phase 2. And we'll continue to talk more about that as we go forward in this presentation. And then finally, for another part of the presentation I have is the impact of managed care and beneficiaries. Here's what we want people to hear. Again, the immediate need is that we want people to get services. But long term, we believe that people enrolled in managed care will be able to have unique services and support provided by a managed care entity. The change that most of these individuals initially will see, though, is that they will be enrolled in a North Carolina Medicaid managed care health plan. They will be able to choose that health plan. But as I mentioned in an earlier slide, if an individual does not choose, they will be auto-assigned to a health plan for their needs. What's really important to talk about is that eligibility rules are not changing. Services provided under Medicaid are not changing. Copays that people have will stay the same. Beneficiaries will still need to report changes to their local DSSs if it changes their eligibility status. And beneficiaries come to you with questions, because some people will. We really want your help to point into the right direction and empowering them with information. And that's part of what this webinar will hopefully be able to do for the members that are on there. But really important to note that North Carolina Medicaid eligibility does not change with the move to managed care. Health plan benefits. So for health plans, they will pay for all of the things that are currently paid for inside of Medicaid Direct or our fee-for-service system. So they'll pay for doctor's appointments, hospital services, benefits, prescription drug benefits. If you want a full array of what those services are, you can go to the North Carolina Medicaid Plans.gov website, North Carolina NC Medicaid Plans.gov to get more information. Enrolling in a health plan will save beneficiaries time and resources. Once they get into health plan, they'll have access to all of the providers that are inside, be able to see the doctor as often as they want. We'll have no monthly premiums, and we'll have access to 24-hour nurse line, and we'll get help referrals to specialty services. In North Carolina, we are moving to managed care with 5 health plans that are available throughout the state. These health plans include WellCare, United Healthcare, Healthy Blue, and AmeriHealth Caritas. Those are 4 plans that are statewide. In addition to that, Carolina Complete Health will be available in 2 regions of the state, and we'll talk more about that as we go into the webinar, deeper into the webinar. So the impact of managed care on beneficiaries' behavioral health needs. We mentioned that earlier, but it's an important topic. Beneficiaries who need behavioral health plan will receive fully integrated, whole-person care in both the standard and tailored plans. Both plans will cover pharmacy services, provide access to behavioral health providers, and have behavioral health crisis lines. The standard plan will cover most of the services that are needed for individuals, all of the services needed for individuals with mild and moderate behavioral health needs, but a significant array of services that are currently provided under the LME-MCO system. The tailored plans will be for beneficiaries with significant behavioral health conditions. Additional services will be available that are currently in the 1915B3 or 1915C services, which typically are thought about the innovations, the TBI, and state-funded services, along with the enhanced benefits that are available for people with mental health needs. These tailored plans are designed around health home care management model, and we'll talk more about that in future webinars. The LME-MCOs, though, will continue to provide the existing services to those people that will ultimately be in tailored plans until tailored plan launch in 2021. And with that, I'd like to turn it over to Sandy Terrell to talk more about where we're headed.
Thank you, Dave. After beneficiary eligibility is determined by the DSS and the population is determined by NC Medicaid will enter this information into NC Fast. That information will be sent to the enrollment broker, which will trigger the mailing of enrollment packets, including the notice that lets the beneficiary know if they are mandatory or exempt for rolling into NC Medicaid managed care. The notice will direct the beneficiary to the enrollment broker to learn more, make their health plan and PCP selections, and complete enrollment. In some cases, receiving this letter will prompt the beneficiary to come to you or their local DSS staff with questions. Beneficiaries who must or can enroll into Medicaid managed care should reach out to the enrollment broker via website, web chat, mobile app, or phone for choice counseling and to enroll. After enrolling in NC Medicaid managed care, the health plan will mail the members a welcome packet, complete with plan information and a Medicaid card. The health plan will answer any questions that members may have about their plan or about specific benefits that they're interested in. Key partners for the NC Medicaid managed care include the beneficiaries, NC Medicaid, local DSSs, NC Fast, NC Tracks, health plans, providers, ombudsmen, community-based agencies, and the enrollment broker. Beneficiaries are at the center of the NC Medicaid managed care and have touch points either directly or indirectly with all other partners in this managed care system. Everyone plays an important role in ensuring beneficiaries are supported under this new model for Medicaid. As stated earlier, beneficiaries are eligible for Medicaid and may be enrolled in a health plan. They can choose their own health plan and their PCP or provider, as well as the provider eligibility, and the provider. Eligibility rules that Dave had mentioned earlier are not changing in this new care model. Medicaid will have the same covered health services, same treatments and supplies as it does today in fee-for-service, or now called NC Medicaid Direct. DHHS and NC Medicaid are responsible for the supervision of the Medicaid program, oversight of the plans, the local DSS agencies, the systems, and all other stakeholders. DSS will continue to accept and process Medicaid applications, determine eligibility, update beneficiary information, and manage Medicaid case management. Systems still used today will continue. NC Fast will remain the system of record for Medicaid beneficiary information, and eligibility information will continue to be sent to NC Tracks. As Dave mentioned, there are 5 health plans, 4 statewide. I'll repeat: WellCare, United Healthcare, Healthy Blue, AmeriHealth Caritas, and there's 1 regional plan for regions 3 and 5, and that is Carolina Complete Health. Some of the responsibilities of the health plans include, but are not limited to, administering managed care, provide health care, member service staff, explain PHP operations, explain the role of the PCP, sending plan welcome packets to members, assisting with making appointments and obtaining services, sending medication, the Medicaid card for managed care members, and, if needed, replacement cards. Additional services will be provided like NEMT assistance for managed care members, fielding questions and complaints, advising appeal and grievance rights and options, providing education to members to promote health, wellness, and disease prevention. Providers will continue to provide health services and must still enroll in Medicaid. The difference now is that they will contract with health plans who are responsible for that member's care. The Ombudsman Program is another beneficiary support that is currently pending, but with plan to be assisting the member with issue resolutions and referrals as needed. This will be a statewide service. The enrollment broker will be responsible for choice counseling, enrollment assistance, and will provide outreach and education to beneficiaries and other stakeholders. Additional services that partners can provide include ensuring that members receive the same services as they did under Medicaid Direct starting day one. They will be provided NEMT services for the managed care members. They will be assisting members with the PCP and the advanced medical home information, as well as auto assignment. Provide NC Medicaid managed care member ID card or replacement cards. They will conduct care needs screenings for the members. They will provide call center and member service lines like the 24-hour nurse line. They will provide support with appeals and grievances, provide plan welcome packets to the member, including the welcome letter, the ID card, and a member handbook. And as leaders in community-based agencies, you play an important role in disseminating information to help educate the public about the changes to the NC Medicaid program. The department also welcomes any and all feedback you may have related to the clients that you serve. Now we will cover more information about what beneficiaries can expect. We will start with an overview of the timeline, including when beneficiaries will receive information, when they must enroll, and when their health plan coverage will begin. This slide indicates the Phase 1 counties. So let's walk through the timing and the regions for these two rollout phases. As you note, the counties in Phase 1, Regions 2 and 4, are highlighted in the blue shaded area. NC Medicaid is planning for a regional phase-in approach for transformation from Medicaid Direct to NC Medicaid Managed Care. These counties are listed in blue, as I said, for the first rollout that will begin November 1st, 2019. During the initial transition period, when NC Medicaid Managed Care is first being rolled out, beneficiaries will have an extended amount of time in which to enroll in a health plan. Existing beneficiaries will receive informational packets from the enrollment broker prior to the open enrollment period. These packets will contain guidance for beneficiaries on steps that are needed to be taken, as well as information about each of the health plans. During the open enrollment period, existing beneficiaries and new applicants will have about 2 months to choose a health plan. However, beneficiaries may begin enrolling prior to open enrollment. As listed in this timeline, open enrollment for Phase 1 will begin June 15, 2019 and end September 13, 2019. I'll call to your attention a reminder postcard will be mailed on August 13, 2019 for this Phase 1 group. The health plan coverage for members in these counties will start on November 1st, 2019, and all beneficiaries must be enrolled by the end of their open enrollment period. If they have not completed enrollment by the end of their open enrollment period, a health plan and PCP will be chosen for them. On the timeline, you'll see this noted on September 16, 2019 as auto assignment. Members may change their assignment within a 90-day window after their health plan starts. After this window of time, members will be locked into the health plan choice and can only make changes if they have a special with cause reason. These reasons may include the member cannot get all needed health services in one plan. Their long-term service and supports provider is no longer in their selected plan. Their current plan cannot meet their medical needs. They may have a family member in a different plan. They cite that the plan has poor performance, or the plan will not cover a needed service for moral or religious reasons. If you get a question about this, you should let the beneficiary know to contact their health plan first, as there may be a way to stay with their plan. If they still want to change their plan, they will need to contact the enrollment broker for a health plan change request form. They will need to complete this health plan change request form and can either mail it or fax it in to the enrollment broker. Let me now talk about Phase 2 counties. Here listed in this slide, you'll see the regions by counties for Phase 2, and that includes 1, 3, 5, and 6, and they're indicated in the green shading. Phase 2 timing for regions 1, 3, 5, and 6 are listed in this slide. Open enrollment for Phase 2 will begin October 14, 2019 and end December 13, 2019. The health plan coverage for members in these counties will start on February 1st, 2020. As we walk through the Phase 1 timeline, you will see in Phase 2 if beneficiaries do not enroll by the end of the open enrollment, which is October 14 to December 13, they will be auto-assigned into a health plan and have a PCP chosen for them, just as if you were in Phase 1 rollout. After they're auto-assigned, they will have 90 days to make changes to their assignment. And at this point, I'll turn this over to Eric Rubin to continue.
Thank you very much, Sandy and Dave, for the excellent overview of the Medicaid transformation and the timelines. In the next section, we're really going to cover three specific areas. First, what is the role of the enrollment broker? Second, how can you partner with the enrollment broker? And third, what does the enrollment broker actually do? Plus, what resources are we going to make available to help you serve the beneficiaries that you deal with every day? So first, about the enrollment broker. The enrollment broker is actually codified in federal regulations. So it is designed to really be a third party who has no interest in the health plans or derives no income from health plans. And Maximus certainly fits all of those criteria. There's really three focuses if you think about the enrollment broker. One is choice counseling. We're going to talk a little bit more about that. Two is the selection of a primary care provider, and then helping people enroll. In addition, the enrollment broker will also be sending out all the notices and mailings surrounding the transition. So if we look at why Maximus was selected, well, we currently touch 1 in 2 Medicaid beneficiaries in the U.S. today. Here you can see on the map in front of you all the various states that we perform these types of services, and we are very excited to bring our expertise to North Carolina starting later this week. Now, what are the exact services that we're going to cover? Well, first of all, let's talk about outreach and education. We actually started outreach to various groups in 2018. So we have been educating people throughout the state for over 6 months. We're going to talk about how we're going to enhance that outreach over the coming weeks and the types of materials that will be available. The second point is our goal with choice counseling is to make sure that we make sure that the beneficiaries have the right plan for the right person. That really is key. And then 3, make sure that they navigate the enrollment process very effectively. If we think about choice counseling, what really does that entail? Well, first of all, we've taken all the materials, all of the information, all of the scripts that the enrollment specialist will be using, and we have written them at a 6th grade reading level. Maximus has within it a group called the Center for Health Literacy that's been nationally recognized for doing this type of work. So we've taken all their expertise, we have put it into the scripts that people are going to be using from the customer service team, and we believe that we will be able to not only help people enroll, but then even help them for self-service down the road. And we'll talk more about all those options in just 1 minute. So when we think about enrollment assistance, what are we talking about here? Well, North Carolina is benefiting from the years of work that we've done. And we'll be launching not only a call center, but also a website, a mobile app, and chat. And we'll talk a little bit more about that. But we will meet people exactly where they want to be met. And if you want to fill out paper, we'll talk about that in a minute, you'll be able to fill out a paper application, mail it in, or fax it in if you don't have access to a computer or just don't feel comfortable using a computer. But we will give people a high degree of self-service, and if that's what they want, then they'll be able to help themselves. But we also know that 60% of consumers really don't understand their benefits, so we will have a fully trained staff, not only in a call center, but also out in the counties that we serve to help people. So what are the options for the beneficiaries to contact the enrollment broker? Well, first, we talked about the website. We're going to get into this in a little bit more depth in just a minute, but people will be able to go to ncmedicaidplans.gov. And at that website, they will have a myriad of information, services, and other items that they can read and download. In addition, the website is web chat enabled, so people are comfortable using that type of platform will have that service. The other item that we're launching is a mobile app. 90% of Medicaid beneficiaries have access to a smartphone. So we know that a mobile app is not only an essential part of today's life, but it is also where many of the Medicaid beneficiaries do get their current information, and they will be using this particular application quite heavily. We also have a call center. You can see the number here is 833-870-5500. You will see that number in every notice that's coming out and all the communications. We'll cover that in a minute, but that's a key number. If you don't have it, write it down because that's the number that you'll need to get to us. We also are very cognizant that some people have hearing impairment. We also know that some people have vision issues. So we have a TTY line, and we've also screen reader enabled the website so that we can meet those needs as well. And as we said, we still accept mail and fax. So again, if you don't like technology, you will be able to use your pen and paper, make your decisions, and then enroll. So let's look at the website for a brief moment. What you can see here is a snapshot of the website. It's really based around the following three questions. It's ask questions, choose a plan and your primary care provider, and then enroll. And enroll in your plan of choice. So as we walk through the website, you will see that it is very simple to navigate. As I said, North Carolina is benefiting from this is the second generation of the website that we've launched. And we know that the first generation was well used. We got lots of feedback from the people that used the site, and we took that feedback and then we've incorporated it here. We know that we're going to get feedback from people in North Carolina, and we welcome it. So please give us feedback as you go out and use the website. One of the things you'll find, there's a lot of program information, brochures, and enrollment forms, all that are downloadable as PDFs. The site is available in English and Spanish, and you could also enlarge the type on the site very easily, again, if you've got vision difficulties. It's important to remember there are two sides to this site. There's a public website, which is what we're showing you up on the screen, and then there is a secure portal that people will be using when they actually choose to enroll. Now, in addition, we know that many people today like to use web chat. It allows people to ask their questions and see a written response, which many people like. So this site will be web chat enabled. That will also be available via the Apple and Android operating systems for people who want to do this via their mobile phone. And at the end of every chat session, we are going to do a customer satisfaction study. One of our key goals is to deliver first call resolution, and we want to make sure that we're also delivering a top-notch customer experience. So we will be using the feedback we get to improve our service as we go. Now, the other way that you can get to us will be through the mobile app. This mobile app, as just like the website, has gone through a couple of generations. This one, again, has been enhanced for our launch in North Carolina. You'll see it is available in English and in Spanish. It will be available this Friday on all Android devices, and then as soon as Apple clears it, which we will expect to get within 2 weeks, it will also be available on all Apple devices. You'll see through this app, and we'll go through a little bit more what the app will do, but you can get into real-time data. You can do plan comparisons, provider searches, which we think will be one of the most heavily used features. Remember, folks, when you're on your mobile phone and you have your location services enabled, it knows who you are, and it will actually pick the providers closest to you without you having to do anything or make any other choices. So that's a really neat feature of the mobile app versus the website. And you'll also be able to have access to all your information. So here's a dashboard. So if you log in and you're the head of household, you'll actually see this dashboard with all the people in your household. If you've logged in and you're not a head of household, you'll only see your specific information. But as a head of household, this gives you a snapshot of everyone, what they're enrolled in, what their profile is, and allows you to make a number of changes. It's easy to get into the mobile app, and we think a lot of people will be using this as we move forward, and we encourage you to go out and download it as soon as it's available for your device. Now, we still have an enrollment call center. So during the open enrollment hours, we are going to be open 7 days a week. That includes holidays. At all other times, we'll be open Monday through Saturday, 7 a.m. to 5 p.m. So our enrollment specialists will be available. Again, the number's up on the screen, 833-870-5500. And we will be there starting this Friday at 7 a.m. to answer calls. They'll be providing choice counseling. They'll be able to help people compare plans. And even if you have problems trying to access the mobile or the website, they'll be able to help you troubleshoot those items as well. We will also have support for a number of different languages, as well as for deaf and blind as well. So if we look at the next slide, we're talking here about one of the other core services that the enrollment broker will deliver, and this is outreach and education. I think a lot of credit needs to be given to the North Carolina leadership. Dave and Sandy, they have recognized that this is a critical part of what the enrollment broker needs to do, and we will have people out in the local DSS offices during phase 1 and then phase 2 to help people navigate this process. We'll be there not only to help the DSS staff, but we will be there to help the beneficiaries as well. The outreach and education doesn't just stop at the DSS offices. We'll also be doing other events, group presentations, and health fairs as well. And we look forward to meeting many of you out in the community. Now, one of the questions you've got to be asking is, wow, you're having all these events. How do I find out about them? Well, right on the website and right on the landing page, you're going to find there's an area that talks about all the upcoming meeting events. So one click will take you to that meeting event calendar, and then you'll be able to see the types of events that we've got. What you'll see are there are partner events where we'll be working with the DSS offices. You also see there are member outreach events where we'll be out in the actual community. We appreciate the invites that we've gotten to come out to the community, and again, look forward to meeting people throughout the state. The key part is you will be able to download and print on demand the materials and the other items that are out on the website. And these will help you as you reach out to your constituents, to the beneficiaries, to the communities that you serve. And I encourage you to go out and look at these materials. So what you'll see on the next page at the bottom is where you can see them. Right now, you can click on this URL. It will take you out to the website, and you can download these materials as well as the notices that we'll cover in just 1 minute. What you see here are the outreach materials. These materials are literally in the mail today, going out to the local DSS offices and should be arriving by the end of the week. There will be posters, that can be placed around the buildings. There are going to be fact sheets to explain to people exactly what they need to do, how the program works. We've got FAQs, as you see up there, and Get Answers. So these are the frequently asked questions. We have what is termed here a palm card, but this is really a card you can place right into your purse or to your wallet, carry with you. It has all the key numbers on it. And we'll also have a flyer available. It's about half the size of a normal sheet of paper. It's great to have in the office lobbies and to hand out to the beneficiaries. So all those materials are available, and I encourage you to go out to the website. In addition, there's an introductory video that's about 5 minutes in length. It is animated, so you can actually just watch the animation. It goes through and explains in a very interactive way what to do, what a primary care provider is, what a health plan is, what a beneficiary needs to do. Not only is this going to be available in the 1 5-minute segment, but we are going to be making this available into 4 different sections so that this can be played in lobbies, or it can be used with people specifically as they come into the offices and have questions about one specific aspect. Now, the other thing that we've been asked quite a bit about are what do the notices look like? So I do realize that some of you are looking at a screen right now, may have a very small computer, and these are a little tough to read, but as you see the URL below, you can go out and download these notices right now and take a look at them. And I'm just going to cover just a couple items at a high level so you can get a feel for how these notices were constructed. First of all, you can see that these are a very clean layout. Number 2, at the bottom of every page is the enrollment broker phone number. So it's very easy to find. Number 3, we've really tried to show people exactly what the letter is trying to communicate. So you can see here with the red box that it's really a clarification about who this enrollment packet is about within the family. Then on page 2, it goes through the 3 steps that people need to take. And it tells you on page 3 exactly what you need to do. And then you'll see on every notice at the bottom, there is a question on the last page. It's a question section. This really links people back to the enrollment broker and to the website. So they can go out, either get questions answered via the website or make a phone call and talk to one of our enrollment specialists. Now, there are several types of items enclosed in the enrollment packet. Next item we're going to talk about also is a mandatory notice. So this, as you can see in the box, is confirming someone's choice. And right up front, you're going to see who the person is, what plan they've chosen, when it takes effect, and what primary care provider, I should say, and who they've selected as their primary care provider. Again, you'll see a very similar metaphor to the first set of notices, in that you're going to find at the bottom the 800 number, the toll-free number to get to the enrollment broker, and again, there's a question section. Now, both Dave and Sandy talked about different populations, so there are different notices. If you're in the excluded population, this notice, and you can see it right in the box, is going to let people know they are going to get the same services that they get today and that they don't need to do anything. Okay? So that's very clear, and you can see this notice is very short, so it drives home that one specific point. We also talked earlier about the exempt population. Now, there are roughly in phase 1 about 40,000 people that may fall into this group. This notice, you notice, is a little bit different because these people could stay in Medicaid Direct and maybe should stay there, but they do have a choice to make. And we encourage this population, and we encourage you, if you've got these members, to have them call and talk to the enrollment broker so that they make the right choice for themselves and for their family. We've also included in the enrollment packet an information flyer, again, covering some of the basic concepts and the tools that are available to the beneficiaries. And as I said, old-fashioned mail still works. So there will be, in every enrollment packet, an enrollment form. People can simply fill this out with pen and paper, mail it back, or fax it in, and it will be processed. Some of the other items that we're enclosing are a comparison chart. So for phase 1, we are going to show the 4 plans that are available. Now, as Sandy said, as we move into phase 2, which are different regions, you'll see that there's a slightly different comparison chart that we'll be sending out later this summer. This actually lists the 5 health plans that are available. In addition, you'll see in the bottom right-hand corner that we've listed the actual counties that Carolina Complete Health is available in, so that there is no confusion. This information will also be posted out on the website, so if you go out, happen to be in phase 2, and put in your zip code, it actually will bring you to a health plan chart like this, so you can see what your options will be, and you will also see the 5 plan comparison. The one last thing in the enrollment packet is some additional information. This is a notice of non-discrimination, but I think even more importantly, on the right-hand side, this is information in 16 languages how to contact the enrollment broker. These are the 16 top languages that are spoken in North Carolina. Through Language Line, we have access to not only these 16 languages, but 100 others. So we can help those people that don't speak English navigate through the process. Now, the last piece is a reminder postcard. As Sandy said, for the phase 1 launch, this will come out in about mid-August. So this will just be a reminder letting people know they still need to make a choice if you haven't made one. Same thing will happen in phase 2, although that notice will come out in mid-November. So we've just covered a lot of information, and what are just a few key takeaways that we want you to be able to share with the people that you serve. First, the services are available via the online and mobile app 24/7, 7 days a week, 365 days a year. You can get access to information. You can make a plan decision. You can enroll when you want to do it. No waiting. So all of that is available. Again, we have a call center. We've talked about the fact that there's the 833-870-5500 number. That call is free. We will be there either 6 days a week or 7 days a week during open enrollment to answer people's questions. And then there's also mail. You can see here that if people want to mail things into the enrollment broker, it's a Post Office Box 613 right out in Morrisville, North Carolina by the airport, 27560. So again, we know some people will want to mail or fax in their information to us, and that is fine. Now, the last thing is, remember, as Dave and Sandy have said, eligibility is determined by the state. So if there are questions about eligibility, you want to contact your local DSS office. If you've got questions about Medicaid Direct benefits and claims, you want to call the Medicaid Contact Center, which is up here on the screen at 888-245-0171. Now, if you also need help then in enrolling in a plan, choosing a PCP, that's where you're going to call the enrollment broker. The mobile number, the number is there, as well as we talked about. There will be a mobile site up, and there will also be the website. And then remember, if people have specific questions about their managed care plan or the benefits, they need to call their health care plan. We have tried to make the whole process as easy as possible for people to navigate. And even if you call the enrollment broker, but you want to talk to your health plan, you're going to find that you can be automatically routed to the health plan that you've chosen without having to dial a single other number. So we've also included here all of the contact information for all of the different health plans. You can see WellCare, United Health, Healthy Blue, AmeriHealth Caritas, and Carolina Complete Health. Here are all their toll-free lines, as well as their TTY lines for your reference. Again, at the bottom, you'll notice that we've listed all of the counties where Carolina Complete will be available, and that doesn't start till phase 2. So we hope that this sheet will be a useful fact sheet for you to retain and to help all of the beneficiaries and the other individuals that you take care of each and every day. So that really concludes the webinar portion. And now we're going to open up the line, if you would, for questions. So hopefully people have been typing in their questions, and we'll answer them.
Thank you, Eric. And thank you, Dave and Sandy, for a wonderful presentation. This concludes the recorded portion of our webinar. Before we begin our Q&A session,